Hey guys, Ben here, and today we're going to talk about benign positional paroxysmal vertigo. So, BPPV, or vertigo, as you may be aware of, is a disequilibrium inside your inner ear which causes dizziness. So, most vertigo causes dizziness, but not all dizziness is vertigo. Now, what happens is, you have a look inside the inner ear. As you can see up in through here, you can tell I did not go to art school. You have three different canals, so anterior, horizontal, and posterior canal, and they all connect to the cochlea, and that whole thing then connects to the brain and tells you where your head is in space. Now, when I look to the right, my vision tells me I've looked to the right, but also my inner ear tells me I've looked to the right. How that happens, you have hair follicles, which sit inside your inner ear canals, and they will sway left or right depending on which way your head is positioned. Now, we have crystals inside the cochlea which help determine those signals from the canals and help tell you where your head is in space. Now, sometimes those crystals break off and enter into one of these three canals. From a numbers point of view, you have 90% occurring in the posterior canal, mostly because gravity likes to push it down to the most bottom position. You have about 9% occurring at the horizontal canal, so it still does exist, but we don't really see it that often. And about 1% of the anterior canal, mostly because it has to go up against gravity, and we don't really see it. So, what happens is, the cochlea breaks off and enters into one of these three canals. In this instance, we're going to talk about the posterior canal, because it's occurs about 90% of the time. Crystal adheres to those hair follicles. So, what happens is, I look to the right. My vision tells me I've looked to the right. However, the hair follicles don't sway left or right because it now has a crystal sitting in between them. So what happens is I get dizzy because my vision tells me I've looked one way, my hair follicles are saying I'm still looking straight, and you get this clash of signals. How this applies to you is what you want to do when you get dizzy is you want to close your eyes, and most of that's because the body is trying to tell you to stop one of those signals coming in, so you're stopping the clash of signals. Now, if you are experiencing anything like that, come on down to All Care Physio and I will assess you and treat you for that, because it's really easy to treat. If you get the right diagnosis, you can be treated for BPPV in 3 or less sessions. Cool. Thanks guys, talk to you later.